Hi all. Today we are going to discuss regarding the writing tips of OET. So what are the tips? Tip 1. Remember that your most important objective in the writing subtest is to finish the referral letter up to the closing part. Whatever test you are getting, like a referral letter or a transferring letter, what kind of letter you are getting, you have to finish within the time limit. Especially that you have to finish with the closing part, like yours sincerely, your designation and your name of the institution, everything should be clearly closed. And failing to finish the task, which is to write a referral letter, may possibly result to a C grade. Therefore, aim to finish the letter at all cost. Planning and time management are key in achieving this goal. So what is the tip 2? The word count only covers the body of the letter, starting from I am writing to refer, excluding the closing paragraph. Closing paragraph, which one is the closing paragraph? Should you need any further information, please do not hesitate to reach me in my hospital contact number or reach me itself enough. So that one, it will not cover under this body of the letter. So the word count, they are calculating from I am writing to refer. That means your introduction paragraph to the end of this fourth paragraph. This paragraph is not considered in the word count. Remember, you could exceed 200 words. There is no automatic penalty for exceeding the word count, provided you would have included relevant and important case note only and fulfilled the writing task. So always try to minimize your word count. Like if it is 180, it is far better. And what is the tip 3? Write an excellent introductory paragraph as the first paragraph of your referral letter. So introduction paragraph is very important in the OET letter writing. This paragraph must provide easy and immediate reference to the intended reader on the most important case note that he must be made aware of and the action that he or she is being requested to perform for your patient. So try to remember always your introduction paragraph. It should contain the full information about the patient, about the person to whom you are referring. That means what is the diagnosis of the patient or the patient or your client, okay, and what is the current situation of this client, what is the like treatment you have given, if any surgery or anything, you can write that surgery, underwent this surgery, like that. And finally, why you are writing the letter, so the reader easily understand why I am reading this letter, what is the role for me, they can understand easily. So everything should be included in your introductory paragraph. Remember that first sentence must clearly state the reason, purpose of your referral letter. What is the purpose of writing? And the action being required from the reader of the letter. What action? Any follow-up care or any physiotherapy or anything? What the action has to be taken by the reader? That should be clearly mentioned in the introduction paragraph. Second sentence must state the primary medical issue of the patient or the reason for hospital admission or the diagnosis and the hospital admission date. Anything you can write in the second sentence. Sentence 3 must provide a brief summary of the patient's current medical condition in relation to the diagnosis. This must provide the reader of your letter the important information on the current medical status of the patient upon referral. Sentence 4 must state the date of discharge or transfer date to the institution where the healthcare person that you are writing to is assigned. So here is tip 4. Keep in mind that OET writing subtest is a process in itself, consisting of different steps or stages. So what are the stages in OET writing? So as you know that there is total 45 minutes available for OET writing. In that, first 5 minutes is your reading time. So during the reading time, ensure to read and study very well the case note. review the relevance and importance of each case note, and develop a mental plan or structure by yourself. You can create a structure for your paragraphs. And you are not allowed to write or mark the writing test booklet during the reading time. So you have to you are not allowed to even you cannot draw with the pencil also that the reading time. So fully concentrate on your reading content, and you have to separate the paragraph. Okay, analyze a plan in your mind. Okay, how we can do it like that. During the 40-minute writing time, follow this process to ensure that you produce a letter which is B grade or A grade quality. The step 1, you have to use 3 to 5 minute time for planning. So underline the keyword in the writing task and in the case note. So initially you have to read the writing task, to whom you have to refer the letter, what is the purpose of writing the letter, and what kind of letter it is. So everything you have to underline in the writing task, and the keywords you have to underline in the case note as it is. Select and include the most relevant and important case note, and exclude irrelevant and unimportant. So when you are reading itself, you have to underline the important case note. Relevant content you have to select, whether this content is relevant to the reader or not. So what is the relevant contents? You have to underline only the relevant content, and ask the question, which case note are important and relevant to my reader, to enable him to provide the necessary care, support, intervention, or management to the patient being referred. Develop a structure or order your paragraph based on the importance of case note or paragraph, with the most important paragraph on the top and the discharge and manage plan as the last paragraph of the body of your letter. Assign a paragraph number to each important case note, paragraph 1, 2, 3, 4, 5, like that, to make it easy for you to pick out the note as you develop your letter, paragraph by paragraph. So when you are reading the case note itself, you can understand that, okay, this content I can keep it in paragraph 3, this one I can keep it in paragraph 4, like that. So you have to write in a side paragraph 1, 2, 3, like that, P3, P4, like that. In with pencil you can just mark like that. So it is easy for you to take the content, particular content, when you are creating the letter. And step 2, writing. You have to take 30 to 35 32 minutes. So transform your important case note into sentence and paragraph by paragraph. Ensure that each paragraph is coherent and unified in terms of main ideas or case note which are related. Use formal writing style and do not just copy the case note. Most of the candidates just try to copy the case note as it is and trying to make the sentence. So you have to demonstrate your vocabulary skill, and you have to paraphrase accordingly and use appropriate and accurate synonyms you can use in order to still maintain the same meaning as the case note. So use different sentence structures like simple sentences, complex sentences, compound sentences, and active passive voices appropriately. In each sentences you have to create different things. Something should be there in each sentence. Most probably you can make complex or compound sentences. Use both active and passive voices you can use also. And step 3 is final checking. Usually it takes 2 to 5 minutes you have to utilize for final checking. You have to check the following before the time is up. Legibility of your handwriting, whether the reader can understand your handwriting or not. Grammar, spelling, punctuations, capitalization, everything you have to check. So what is the tip for success? Did you know that linguistic features consisting of grammar and cohesion is one of the 5 assessment criteria used by the OET Australia-based assessors to determine the OET grade for your referral letter? In preparing for the OET, make time to polish your grammar knowledge and skills on what is verb tenses, what is subject-verb agreement, parallelism or parallel word structures, Capitalization, how to use the proper or common nouns, and complete and accurate sentence structures, and word forms or part of speech like noun, verb, adjective, adverb, etc. Proper use of articles, a and the, correct use of prepositions, collocation or word partners. So all these things we will go through the next classes. We will be seeing what is all these things related to the grammar. And of course, proper and appropriate use of cohesive devices, linking words to unify your ideas, sentences, and paragraphs, such as in addition. Like, what are the linking words or connecting words? In addition, moreover, furthermore, consequently, as a result, hence, therefore, however, on the other hand, subsequently, etc. Do not simply copy the case note. As applicable, paraphrase and use a suitable and accurate synonyms to ensure consistency with the case note. As we discussed earlier, do not copy the case note. Impress the OET assessor by exhibiting your English language written ability and broad range of vocabulary. Your letter must be factual and objective and faithful to the meaning and content of the case note. Avoid emotional and opinionated phrases like sadly, unfortunately, ideally. On the positive side, I can say that do not use like this emotional and opinionated phrases. Your job is to present the case note and make referral only, and not provide any diagnosis or insinuations, conclusions, and opinions. You are not the doctor, okay, or the person to whom you want to diagnose the things. Whatever given in your case note, you can make it out same thing. And if you want to create like diagnosis, they will be mentioning there, this is what is the diagnosis, usually they are mentioning. So don't create your own insinuations. Avoid informal language. Informal language is like instead of children, we are telling like kids. So don't use kids, two kids. Instead of that, we have to say should be two children. Exam should be examination. We should not use the informal language exam. It should be examination. I hope you understood regarding the informal language. Avoid abbreviations in the body of the letter. Mother was also educated regarding RE colon. So this is the abbreviation used here, colon. You should not use the abbreviations. It should be regarding the importance of antidepressants. You should not use the contractions. Avoid contractions. What is contraction? Doesn't, wouldn't, don't. Okay. So this kind of contractions should not use. You should be use does not, should, here don't, instead of don't you have to write do not. So like that you have to mention in the letter writing. Use academic and higher level of English vocabulary or multi-syllabic words. Example, instead of do, use perform or administer. Instead of needs, use requires. Do not use phrasal verb. Example, look into, use examine. Went up, use increased. Use varied sentence structures, simple, complex, and compound sentence. Use combination of active voice and passive voice. Okay, so all the best for the OET learners. Thank you.